Hello, everybody, and welcome to a special episode of Gilded Age. I'm Walker Bragman.
I'm Alex Koch.
There we go. And today we're joined by Justin Feldman, who is a social epidemiologist with Harvard's FXB Center for Health and Human Rights, and he has spent the pandemic studying the effect of COVID on communities of color, among other things. So we're very honored to have him here with us. Today, we're going to be going through an article. It's called Flattening the Curve or Flattening the Global Poor, How COVID Lockdowns Obliterate Human Rights and Crush the Most Vulnerable. We're going to be talking about that article and a recent segment the author Max Blumenthal did on the Jimmy Dore Show. Just to clarify, I will not be talking about his personal attacks on my family. I don't think they're relevant. Suffice to say, I did not call a lawyer or have lawyers contact Max. Max and I have mutual friends who are lawyers who reached out to him after he shared a smear tweet about my family. They did not do so because I asked them to, and neither one of them practice in New York or DC and couldn't represent me in a case against him anyway. So let's just put that aside, and we're going to talk about factual errors in this article and on the segment with Dore. Justin, thank you very much for joining us. Let's get into it.
Yeah, thanks for having me back. I was on the podcast in March. I just checked. It's been a lot has changed, but very little has changed. So I feel like that episode is actually still relevant if people want to go back and check it out.
Time is a flat circle.
Yeah.
So the first thing I wanted to do is ask you, as somebody with expertise in this field, what your impressions of Blumenthal's article were reading it.
Yeah, so the article basically argues, it's a familiar argument we've been seeing since maybe the summer of 2020, that so-called lockdowns harm the poor in various countries, and like in the global north, but also in other countries in the global south, and that the public health measures themselves are more harmful than the virus. And the argument's wrong in many ways, but I would just, the first thing that stuck out to me was the lack of consideration of countries like China, Singapore, South Korea, Cuba, countries from various parts of the world that weren't really considered, that did pretty excellent job, at least early in the pandemic, of suppressing coronavirus transmission, and in many cases doing it in a way that was more equitable, that supported people at times when they needed to stay home from dangerous working conditions.
So what you're saying is that more people have died from the virus than lockdown measure. First of all, can we define what a lockdown is? Because I feel like that's sort of nebulous, and I didn't get that reading this article.
Yeah.
I don't know what, when he says lockdown, he seems to be referring to any pandemic control measure.
Yeah. So this has been one, and I'm sure we'll get into this in a little bit. I really do have to already get to the background, the history on these kinds of arguments, which is this initiative to oppose public health measures, which came out of right-wing think tanks like the Hoover Institution and the American Institute for Economic Research. When they started making these arguments, they referred to, basically anything as lockdown, anything meant to stop or lower transmission of the virus. So that's everything from sort of the broader public health measures, like we saw in places like New York City and San Francisco, where most people were working at home or not working, and being in the US for sometimes were supported by additional government unemployment insurance. But they also use that to include things like quarantine and isolation after potential exposure when you're currently sick, testing measures, masks even. They basically include anything we're trying to do to mitigate risk as lockdown.
One of the things that keeps coming up in response to that, when we point out that these are, business aligned organizations, is they always, the response is, well, Amazon and Netflix did very well. But just to give some numbers here, these are from McKinsey, which, for those who don't know, is a global management consulting firm that Pete Buttigieg once belonged to. What they're saying is arts and entertainment and recreation, that's going to take the longest time to recover. Accommodation and food services will take the longest time to recover after this pandemic. Educational services, transportation and warehousing, manufacturing, mining, quarrying, and gas extraction all took a major hit. Wholesale trade took a major hit. Administrative and support services, utilities, finance, insurance, construction, retail trade, management companies and enterprises, real estate. I mean, these are there's more to the economy than just Amazon and Facebook and social media companies. Like, some companies did do very well, although I doubt those companies would want their business shut down in a hard lockdown.
And there was no lockdown in the U.S. Really. Like, there were some states or counties that it was really between March and June of 2020 that we saw these sort of wider public health measures being implemented: temporary closure of non-essential businesses, paid furloughs of workers at those businesses, shifts to remote schooling. That happened during that period of several months. By the winter of 2020 to 2021, even in most Democratic-run states, there were few measures like that implemented. And I looked back in January 2020. At that point, all but 4 states had open indoor dining. So if your indoor dining is open, you're not doing a whole lot to try to control spread of the virus. So you could say that Amazon did well because of lockdown. Actually, there wasn't much lockdown in the US. And a lot of people didn't go shopping in stores. They didn't go to indoor dining because they were afraid of getting sick, not because the government was ordering it.
And I'll just say too that as Walker kind of intimated, some of these businesses like online marketplaces and social media, when a lot of people, as Justin says, often by their own volition, are just home a lot more or fearful of going into sorts. Of course, those businesses are going to do well under a pandemic condition. But I think what Max Blumenthal and Jimmy Dore allegedly claim, which is that businesses in general thrive during the lockdowns. I think they're referring to the stock market, which is very different from the actual business's year-to-year revenue or month-to-month revenue or market cap even. We're talking about the investors who are just trading in the market, and those companies have done great. I mean, Elon Musk manufactures electric cars and has a, I guess, defunct space business, and he became the second or perhaps the most richest person in the world over a few months because of just weird weird marketplace stuff going on. That doesn't mean that businesses across the US were booming.
Right. And it is worth pointing out also that, like, we did see a major stock market tumble in March of 2020. I mean, Ford Motors saw its stock, go down into the single digits. I mean, that's, like, we did see, like, major companies suffering. So yeah. Anyway, let's move on with the claims of this article, and then we can go into the video clips, which are going to be the most fun for people watching this. So, I think there's another claim that they make in the article is that these pandemic measures are a gateway to authoritarianism. This seems another thing that you would be very qualified to speak about, Justin.
I mean, I think it's kind of a vague thing to say. I think they mix a grain of truth in with a lot of distortions in this article. And I think the grain of truth is that in a pandemic or at any time, there's a balancing of what you can think of as positive rights and negative rights. And usually the sort of libertarian right-wing types are exclusively talking about negative rights. They want freedom from governments intervening in their lives. But there's this set of positive rights, which in this case is the right to live a safe and healthy life, not infected by a deadly disease, not passing that disease on to people you love who may be even more vulnerable than yourself. So different countries have sort of balanced those in different ways. And you can point to particular examples that you might disagree with, that I might disagree with, but they really need to be understood in the context of trying to prevent a pandemic. So we've in the US had nearly 800,000 official deaths from COVID, and many more cases of severe illness, some of them resulting in long-term disability. We've had probably around 150,000 children orphaned over the course of the pandemic. So these are really terrible things, and these are forms of rights violations. The government failed to protect our right to a safe and happy life. And other countries have balanced it differently. So we've, for the most part, been able to have the right to go out and eat in a restaurant in person, even before people could be vaccinated. Go to a workplace, expose your fellow coworkers unvaccinated. Like these are rights that up to now have largely been enjoyed in the US, enjoyed kind of in scare quotes there. And in other countries, they've said, no, we think this prospect of a huge number of people dying or being disabled is not tolerable. So we're going to do some things to try to prevent that. And sometimes in common cases, sometimes in rare cases, that can result in things like mandates or more sorts of coercive measures. And yes, you can absolutely have legitimate debates about where to draw the line, but to say that allowing mass death is fine as long as you're upholding people's liberties understood in a very particular way, I think kind of misses the bigger picture there.
So let's talk about evidence of whether or not lockdowns are actually an effective measure in controlling the spread of the virus. Now, the article asserts, it claims up top that there is no evidence or weak evidence to suggest that lockdowns actually reduce the spread of the virus. And the source for that, we'll talk about him later, but there's an individual named, and then there are several studies offered up as evidence. Now, what is your experience? What is your understanding of the science surrounding this, and whether the evidence that which way it suggests? Do they help reduce the spread? Do they not?
Yeah. So one thing to note here is that basically anyone can do a study of any quality. You can make whatever point you want. You can abuse data and abuse logic, and you can put that up on a preprint server where no one's peer reviewed it, or you can publish it in sort of a questionable journal, and even sometimes more legitimate journals will allow something to slip through that's not of particularly good quality. So if you want to cherry pick studies out there and make whatever point you want, you're able to do that. That doesn't mean it's good science. At the most basic level, so lockdown, what's being called lockdown is actually many different kinds of what we call public health measures, or technical term, non-pharmaceutical interventions. And if we talk about sort of the most broad and effective ones that involve paying people to stay home, or shifting office work to remote modes, or doing hybrid or remote schooling, There's very high quality studies showing that those are pretty effective, especially when done at the right time and for the right length of time, pretty effective at reducing the spread of the virus. And it makes sense. So this is a virus that largely spreads indoors from one person to another. So if you reduce indoor contacts in society, of course you're going to reduce the spread. So if people aren't interacting with each other in an institution like a school or a university, in a workplace, if you're substantially reducing those interactions, it's unfathomable to think that you're not reducing the spread.
You know, and I did take a look at some of these studies that Blumenthal cited. Just I wanted to see the quality of the evidence. And he says medical researchers and doctors, and gives the names, write in a country level analysis measuring the impact of government actions, country preparedness, and socioeconomic factors on COVID-19 mortality and related health outcomes, that, quote, government actions such as border closures, full lockdowns, and a high rate of COVID-19 testing were not associated with statistically significant reductions in the number of critical cases or overall mortality. Sounds bad. When you look at the study, in that study is also this nice little line. The government policy of full lockdowns versus partial or curfews only was strongly associated with recovery rates. Similarly, the number of days to any border closure was associated with the number of cases per million. This suggests that full lockdowns and early border closures may lessen the peak transmission and thus prevent health system overcapacity, which would facilitate increased recovery rates. So right there, I mean, I don't know how you frame that as lockdowns are pointless and don't work. I mean, that's that to me is just bad journalism. I wouldn't do that. I wouldn't, if I were going to, if I were citing a source, I wouldn't do that. Similarly, he cites a 2019 report from the Global Influenza Program, which is already, talking about a different virus, that says that the evidence, he quotes, the evidence base of the effectiveness of non-pharmaceutical interventions in community settings is limited, and the overall quality of the evidence was very low for most interventions. Okay, fine. But then in the report itself, it says the most effective strategy to mitigate the impact of a pandemic is to reduce contacts between infected and uninfected persons, thereby reducing the spread of infection, peak demand for hospital beds, and the total number of infections, hospitalizations, and deaths. I mean, I don't know how you square the framing from the article with the content of the thing he's citing. I mean, Alex, you're a journalist. What do you think?
I mean, it sounds like cherry picking to fit a narrative, which unfortunately is, I think, pretty commonplace with certain sectors of the internet. But I also want to address something that is a little more of an extension of the lockdowns or lack of lockdowns. Because of lockdowns, whatever degree we're talking about, that did reduce the spread of a virus that passes in the air from one person to another. It is a very contagious virus that passes from person to person, and it's just outrageous to claim that if we reduce significantly the personal interactions, that the virus will spread at the same rate, if that it won't decrease. That's crazy. But in terms of variants, which we're experiencing now, we now have the Omicron variant after the Delta variant has essentially taken over all the cases in the United States. So now the Omicron's coming in. We'll see how the two battle each other. But again, when you're not locking down, you're increasing the transmission, and thus you're increasing, especially before we had the vaccines, the likelihood that these variants are going to form.
Yeah, absolutely. So each time the virus infects a new person and replicates within that person, replication is what causes the ability for variants to create. So there's mutations when replication happens. So by reducing the amount of replications through a combination of vaccination, which makes it so that there's fewer replications within an individual, and all these public health measures which also prevent transmission within whole societies, you're in a much better place to reduce variants. And then you also have to think about things like global vaccine equity there. So you have this hoarding of intellectual property by companies like Pfizer and Moderna. So you have countries in the global south with extraordinarily low vaccination rates because they can't afford the high prices being charged.
Let's get into the clips, because I think they, if we go through the entire article and then we go through the clips, it's going to be redundant. And I think you really have to see these arguments being made to fully grasp them. So let's take a look at the first clip.
Endless emergency. The public health justification for these non-pharmaceutical interventions has not only been discredited in the eyes of millions across the globe, but by an array of scientific studies and data demonstrating that they likely caused more deaths than they prevented. That's interesting. As the World Food Program warned in 2020, 135 million people on Earth are marching towards the brink of starvation as a result of their economies shutting down to supposedly inhibit the spread of COVID-19. For most people on the planet, the economic and psychological harm experienced during the past 19 months was not the result of the pandemic per se, but of emergency order restrictions governments imposed on them and justified as public health measures. In the global north, such costly efforts did little more than delay the inevitable spread of COVID-19 while transferring wealth into the hands of big tech oligarchs who constitute the pandemic's real winners. So that was by the way, that was definitely an effect of the lockdowns, that it transferred wealth upward. So workers got flattened, and I think we created a new 40 new billionaires.
All right. So basically we've already talked about this, but yeah, what's your reaction to that?
You can see just how lacking in specificity there is here. So it's kind of hard to pin down any particular part. So the US didn't have anything like a national lockdown. On a global scale, the US response was quite weak. There were a few states and a few cities for a few months that did something that you could call a lockdown, perhaps. And I would also return to this point we were going at before. I would kind of turn it on its head. I would say the US was able to have such a poor response precisely because the stock market and real estate market continued to do well. And the people who were dying were poor people and people of color and disabled people.
Yeah, and it is interesting that he quotes the World Food Program here. And if you go to that, if you actually go into the article or where he cites from, where he says the 135 million, you see that while it does say that lockdowns and economic recession are expected to lead to a major loss of income among the working poor, it also notes that overseas remittances will also drop sharply. This will hurt countries such as Haiti, Nepal, and Somalia, just to name a couple. The loss of tourism receipts will damage countries such as Ethiopia, where it accounts for 47% of total exports. The collapsing oil prices in lower income countries like South Sudan will have an impact significantly, where oil accounts for 98.8% of total exports. And of course, when donor countries' revenues are down, how much impact will this have on life-saving foreign aid? So there's a number of factors. There's a confluence of factors that are listed, and he's attributing this all to lockdowns.
Yeah, and also, Dor mentions mental health issues that came out of lockdowns, which is a real thing. And I and plenty of other people I know had some depression last year. I mean, so this was very real. But if we're talking about, uncontrolled global pandemic without a vaccine as of last year, no restrictions whatsoever versus a very slight and really unfortunate and depressing uptick in suicide rate. Nothing even on in the sphere, the plane of COVID deaths, right, in terms of the statistics. So we're talking about uncontrolled pandemic versus a slight uptick in suicides. They're not comparable, and both are tragic, but they're absolutely not comparable in terms of numbers.
And so there was speculation early on that suicide would go up in many countries, but actually in many countries, it's slightly decreased.
Okay.
Somewhat surprisingly. And you can also compare, so there's been surveys around like, are people experiencing depression and is that increasing? And you can compare data in countries that did a lot to try to prevent spread of COVID through non-pharmaceutical interventions to those like Sweden that did very little. And they're all doing pretty poorly. So it's really hard to differentiate the effects of public health measures from the effects of living through a pandemic that is killing many people and restricting your life. Because most people aren't going to go out and live their lives as normal because they don't want to be infected by the virus, especially before they were vaccinated. While they were vaccinated, it's slightly more complicated. And then again, there's no mention of the various approaches of the biggest countries in the global south, China, India, Brazil. And when you actually talk about those countries and compare their approaches, obviously China, with its zero COVID successful approach, like they're doing pretty well in terms of not having to deal with either the virus itself or, for the most part, onerous restrictions. Most of the country has kept itself fairly free of the virus. There are travel restrictions, there are border regions where there have been a lot of lockdowns. So it is more complicated than that. But it's certainly better to be living in China in the last year than in Brazil, where there's basically been unmitigated spread, and in India, where there were some early efforts to do lockdown, which actually did cause a lot of problems for the migrant worker populations. And then they basically let it rip after that. And these Brazil and India are countries with right-wing governments that took a more lax approach to controlling the pandemic, resulting in many, many deaths.
We wanted to take the narrative around lockdowns to the woodshed, just using cold, hard facts. And I really am grateful for Stavrula Pabst for bringing me her research on lockdowns and writing and working with me to shape this up into kind of a master narrative about the violence and brutality that people around the world have been subjected to for what was a medically futile non-pharmaceutical intervention that had previously been considered off limits, even in pandemic situations, by public health officials and scholars and epidemiologists. And we can see the damage just in front of our eyes. But you mentioned how the lockdowns and restrictions were a boon to big tech oligarchs because everyone's stuck at home. Amazon stock surged, it went down in late spring, early summer of this year because the lockdowns began to end. Bill Gates of Microsoft, who cashes in on remote learning technology and other technologies that everyone was forced to rely on and licensing. He increased his fortune by, I think, 25 billion in 2020 alone. Billionaires increased their wealth in the US by 54%. The top 1% of US households now control more money than the entire US middle class for, I think, the first time. And that is a direct result of what we talked about, the CARES Act, just pumping money directly into Wall Street,
That's
and then forcing everyone else, the working class, to stay at home and get obliterated.
Well, can I just say a couple things? Well, first of all, when we were in an alleged national lockdown, which, as we've said, did not happen, the Amazon workers were still in the factories, putting shit in boxes and sending them out. And when the alleged lockdown broke, Amazon workers were still in the factories, putting shit in boxes for us. So that didn't affect them whatsoever. And even worse than that is the chicken processing plants. Remember when Trump ridiculously, designated meatpacking as an essential service. These poor, mostly immigrant workers were in there getting COVID at alarming rates, way, way higher than the general population, just to package meat and send it around the country to supermarkets. So neither of those things were affected whatsoever by any alleged lockdown or semi-lockdown or anything like that.
And there's also kind of a distortion of what was in the CARES Act there. So it's true there was a lot of money given to businesses in sort of unaccountable ways. It's also true that it expanded unemployment insurance under pandemic unemployment assistance program to $600 a week on top of what people already were getting. So this allowed a lot of people, and it expanded it to cover gig workers and other people who often are excluded from unemployment benefits. This allowed people in sort of piecemeal ways to stay home and protect themselves from workplace exposure to COVID. And for the large majority of people who were collecting unemployment insurance, their unemployment checks were larger than their wages at their job.
Because our horrible federal unemployment. Federal
according to the
minimum wage
Census
is
Bureau,
abysmal.
According to the Census Bureau, poverty, which is defined as a family of four living on $26,250 a year, fell from 11.8% in 2019 to 9.1% in 2020. So we reduced poverty, which is to the lowest rate. That is 9.1% is the lowest rate ever recorded. And most of that was attributable to stimulus checks, which helped lift 8.5 million Americans out of poverty.
And I'm not sure what Blumenthal and Dorr and everyone else in their crew thinks about just giving people money to stay home, or to just in general giving more people money. If you don't have any lockdowns, right? If you're basically denying the existence of a very contagious pandemic, you're probably not, as a government, also going to give people extra money. So that basically, by arguing for completely ignoring a pandemic, I think you're kind of de facto, in this country at least, arguing for no more social assistance to anybody.
Yeah, I mean, look, these programs did work. And by the way, it's important to realize that wages have been growing, and that is a direct result of this relief, because for the first time, workers had flexibility. This gave people flexibility in their job selection, and they, a lot of people had more money than they'd ever had. I mean,
and a lot of the strike wave that we're seeing in labor, I mean, it's unprecedented in the modern era. And a lot of it does come from that experience of actually doing somewhat okay in some cases, a lot more than normal in an unemployed situation. So we should have another episode talking about the labor implications of the CARES Act and just of the COVID era overall. But that's also something, important to point out.
Yeah, let's do the third clip here.
Well, look at the toll on American workers. 40% of people making under $40,000 annually lost work. Unemployment went to almost record lows for Black Americans and Latinos. Almost 3 million women were driven out of the workforce because they couldn't balance work and caregiving. We saw dozens of airlines fail. 200,000 small businesses were completely shuttered. And if you want to try to understand what happened in the New Jersey gubernatorial race, where Phil Murphy was almost beaten in a deep blue state by a fairly obscure Republican, Chitterelli, look at Atlantic County, the home of Atlantic City, where 1/3 of restaurants and small businesses were put out of business under Phil Murphy's lockdown, one of the hardest lockdowns in the United States. He even acknowledged that it was too harsh. And New Jersey, throughout fall and winter, has had one of the highest case rates of COVID in the country. So it's completely futile.
Let me just say, first of all, that New Jersey is not a deep blue state. They had Chris fucking Christie as the governor for 2 terms. I mean, that's absurd. They have a Democratic billionaire as governor right now who's not exactly progressive. So that's not an accurate statement. And here's the other thing:
causation, or like chicken or the egg, right? Like But which came first here? The horrible spread of the virus or the lockdowns?
I mean, it's just the arguments he's making are, one, they're like kind of traditional right-wing populist arguments, like these tech oligarchs are evil and they're benefiting, but these other segments of capital are being hurt and they're legitimate segments of capital. So airlines failing is bad, but giving money to large corporations is bad. Like, I don't understand the the argument he's trying to make there. Like, what is his class analysis?
Right. And also what that kind of something to along those lines is that he was talking about, like doling out money to Wall Street. Actually, the CARES Act, they gave a lot of money to small businesses, and a lot of them did shutter because it is tough. Like in March of 2020, it's hard to keep your restaurant open. But a lot of these businesses at least had the opportunity, despite the bureaucracy of the United States government being pretty tricky and probably a lot of them getting denied for major COVID forgivable loans.
Yeah.
But what I was going to say earlier is that what Blumenthal is doing here is he's conflating angry individuals who some of whom were animated by the lockdowns, did not like them and their voting habits, with what's actually good public health policy. And those are two very different things.
If anything, to me, this just screams that our assistance to people was not robust enough, right? That it's too means tested, that too few people qualified, that even though we saw a dramatic impact from the policies that we did have, imagine if we had more robust policies. I mean, if every American were getting a $2,000 check every month, we could have, that I think would have eliminated poverty as we define it.
What he's talking about with record unemployment, obviously unemployment is bad. I think we should have a jobs guarantee where every single person in this country can have a job if they want it. But he doesn't mention any of the subsidies, the increased unemployment checks that Justin's talked about, the several government checks that people under a certain income got. And so, and if you're talking about, would people rather stay home and be physically safer, as opposed to just going to work at McDonald's every day during the entire pandemic? I don't know. I would think a lot of people would prefer to stay home. If you look at the numbers on parents initially, kind of in the last fall, who kept their kids home, a lot of families of color, especially, decided to keep their kids home when there was the hybrid school model.
Yep. It was so that indicates that white people that wanted their kids in school.
They wanted their kids to, yes. And so the point is, what I'm making is, Max Blumenthal is trying to say, Black Americans were disproportionately affected negatively by the lockdowns because it made them unemployed. So while that may or may not be true, obviously the COVID pandemic has been devastating to Black Americans, communities of color, because of our healthcare system and other factors. But it doesn't mean that every Black person who's unemployed wanted to go work in the apex of a pandemic.
And in fact, there was just a survey, I think, released today, commissioned by the U.S. Chamber of Commerce, ironically, that the main reason why unemployed people continue not to participate in the labor force right now is fear of contracting COVID. We don't have occupational safety and health regulations in place covering all industries. There was an attempt to do that earlier in the Biden administration that was actually killed by groups like the Chamber of Commerce, and a newer one that's narrower and only focuses on vaccine that the Retail Industry Association is suing to prevent. So all of this gets kind of swept away. The fact that something like 150,000 working age adults have died in the pandemic gets swept away.
Yeah, and it's also this is dovetails with something that we're going to talk about in a little bit, but maybe unintentionally, perhaps even unknowingly, these folks like Blumenthal and Dorr are basically saying the same things that a lot of these right-wing business groups are saying. So take that for what you will. But
hell, let's get into that. Let's get into that, Alex. Give us the rundown here, because Blumenthal, the only person with a medical background that Blumenthal cites in his piece is Jay Bhattacharya, who is the author of the Great Barrington Declaration, which argued for herd immunity through infection. Target protection for the most vulnerable, but it doesn't ever really lay out what that means. And then let the virus rip through the young and healthy population. Why
don't we start with Justin on this? So what's as an epidemiologist?
Yeah.
What do you think about that idea of just complete herd immunity?
Yeah. So there's different ways to parse it. One is, if you were to watch this group, Jay Bhattacharya and some of the people he worked with on the so-called Great Barrington Declaration, many of them argued over and over again that we're very close to achieving herd immunity, so we can let all these measures go away, and then the virus will just kind of like go down to pretty low levels and we can ignore it. That, of course, didn't happen. And then we got new variants precisely because we let the virus spread so widely that are more and more transmissible. And we're really at the point where we can't rely on herd immunity, even herd immunity through vaccination. We really need to vaccinate nearly the entire population, and we need to combine that with other public health measures. So they've not been vindicated. They did argue to protect the vulnerable, which they largely defined as 65 and up, and let the virus spread through the rest of the population. But they never really offered concrete ideas about how to protect the vulnerable. Jay Bhattacharya did at one point suggest something like subsidizing online food delivery services, like grocery delivery services. It's like
Amazon Fresh. That's Amazon Fresh, folks.
Of course, we got to have it done through private businesses. You can't have the government handling that. That would be
well, and there's that would make sense for a guy who what is a former research fellow at the Hoover Institution, which is a right-wing think tank that's housed at Stanford, but I believe is independently funded. And this is an institute that was created by Herbert Hoover in 1919. Not one of our best presidents, by the way. It's been a conservative think tank ever since. And as a researcher of the right-wing kind of money networks and the Charles Koch network, I can say that the Charles Koch Foundation is a very significant donor to the Hoover Institution. They've given $430,000 since 2014. And concurrently, the Charles Koch Network, Americans for Prosperity, and all those advocacy groups that he funds have been raging against the lockdowns. Again, kind of like the Chamber of Commerce and things, but a little more extreme. And basically fighting any kind of government health measure because they want their profits to keep coming in. Other right-wing funders of the Hoover Institution, just to give you a little background, the Atlas Institute, the Bradley Impact Fund, which is a donor-advised fund sponsor that's connected to the Bradley Foundation, one of the biggest sponsors of right-wing state-based think tanks in the country. The Deramus Foundation, which is a little more obscure, but I will say it funds hate groups like the David Horowitz Freedom Center and the Remembrance Project, both anti-immigrant, anti-Muslim hate groups. Also, the Helen Diller Foundation gave as recently as 2014, and she's also that foundation is also notorious for funding anti-immigrant hate groups. So that's just an example, a background of the institution that employed and Bhattacharya, but also Bhattacharya continues to appear in multiple panels, often about COVID and lockdowns and things, hosted by Hoover. So he's still quite involved with Hoover. And then there comes, I guess, the group behind the Great Barrington Declaration, right?
Yep.
So that's
tell
the
us
American,
a little bit about that.
Yeah, so that group is also funded by Charles Koch. It's called the American Institute for Economic Research.
To be clear, you pulled all of their fundraising for them. You just looked at these groups at who their funders are.
I pulled some stuff. I looked at Hoover in the past, but for AIER, American Institute for Economic Research, Charles Koch Foundation gave $103,000 from 2018 to 19. We don't have the Koch Foundation's 2020 tax records yet, so we'll see if they gave last year during the pandemic. But I would think it's quite likely. Also, the Atlas Economic Research Foundation is a funder. That's another kind of libertarian economic network. And also the Bastiat Society, which is of sort of right-wing Austrian economics focused network, again, also funded by Charles Koch. The board of AIER includes a few professors I recognize from my past reporting on Koch-funded economic programs at universities. So these are people, some of whose salaries were funded directly by the Koch Foundation in these free market economic programs that served Koch's libertarian interests. Also, I'll just say one other interesting fact I found was one of the program director for the American Institute of Economic Research, Brad DeVos. I don't know if he's a member of the famous DeVos family. I'm not sure he is, but I did look at his bio, and he's a member of the Mont Pelerin Society, which is another Austrian economics group. funded by Koch and by the Atlas Economic Research Institute. So you can see these are a very tightly knit kind of sphere of several groups, all funded by Koch and kind of like-minded billionaire right-wing donors that push, very extreme free market principles, very anti-regulation, and obviously pro-business messages. So that's kind of where the Barrington Declaration came from, which Bhattacharya was one of three primary authors.
So let's take a look at what Dorr and Blumenthal had to say about this group.
Yeah, the Great Barrington Declaration is essentially the first attempt of scientists and medical professionals to present a counterproposal to the quote unquote science that has devastated so many and been so discredited in the public eye. And what they called for was focused protection of vulnerable communities instead of hard lockdown, of quarantining individuals who are infected instead of quarantining an entire population that is healthy, of taking a much lighter touch to protect not only the economy, but to protect people's jobs, their abilities to pay for their homes and not be evicted and thrown into the ranks of the homeless, as we've seen. And the understanding that if you put a population under lockdown, you're effectively sanctioning it the way the U.S. empire sanctions countries where it seeks regime change and winds up causing hundreds of thousands of excess deaths of the poorest and most vulnerable. The Barrington Declaration is said to be supported by business interests, according to Walker, including the Koch brothers. And even if that were true, I still would have quoted Bhattacharya because he's been proven right at every turn. And I think it's important to listen to the skeptics and give them credit regardless of their politics. But the fact is, and I put this directly to Bhattacharya, Martin Kulldorff, and Sunetra Gupta, who are the three main figures. Gupta is also a self-identified leftist behind the Great Barrington Declaration. Did you take money from the Koch?
Self-identified is
pretty important. Say they did not. They never took money from the Koch brothers. So what Walker's saying is totally false here, but I think it's beside the point. I mean, the point is, did lockdowns hurt the global poor? Did they hurt the American working class? And he's trying to deflect from that debate.
Well, I mean, I'm satisfied. I know, Alex, you pulled their financing, but I mean,
God forbid, an organization that has a relatively small budget gets a relatively decent size of it from the Koch Foundation, orchestrates this declaration, but no, the three authors have nothing to do with that money at all. I'm sure never factored into it whatsoever. That's how it works, guys. When you fund something, especially with the Koch Foundation, they are known for not really monitoring their grants at all. They give money to universities, and it's not they never would do a year to year checkup on multi-year grants to make sure that the money's doing what they want. No, they've never done that, folks.
So I've done very deep dives in all of these groups since September 2020. And a little more interesting background here. So a high-level Trump administrator back in March 2020 addressed the board of directors of the Hoover Institution and basically said, this pandemic is coming and it's going to be really bad. And these are like industry leaders, CEOs, that kind of thing. They gave that message just as Trump was saying publicly that it was going to be no big deal. A couple weeks later, Jay Bhattacharya is hosted at the Hoover Institution saying, we don't need to really do anything to control spread of this virus. And then AIER organizes this group, and we don't have solid evidence of who's getting paid or not, but what we do have solid evidence that this fringe group of scientists is having their voices amplified by this right-wing ecosystem through Republican politicians to whom they're often giving advice, many times in public hearings, and also in media. So there's a close relationship between the Hoover Institution and the Wall Street Journal, for instance. And the Wall Street Journal is regularly placing op-eds by people like Jay Bhattacharya and Martin Kulldorff.
Well, that's great research, and also it just points towards the plain facts that opposing lockdowns is the pro big business standpoint. I mean, again, as I just described, both Hoover and AIER are funded by free market, Charles Koch tied interests. I mean, clearly Blumenthal didn't do his own research, or he's lying, because it's pretty simple search on ProPublica to find out a couple of the funders of AIER. Um, and I'm happy to show him how to do it if he'd like to learn that a little bit of investigative journalism. I mean, I'm being serious. It's actually a tool that very few people use, and it's quite easy. But that aside, this is clearly this is what the big right wing billionaire GOP donors want. So if your argument is that lockdowns are actually bad for the poor, and you're siding with big corporate billionaires, it might be the opposite.
So let's go back. Let's go back to the assertion now that lockdowns are more harmful than they do more harm than they do good. Let's just go back to that. Here's another clip talking about New York, where this is again in this clip you're going to see Blumenthal again sort of blend the line between the causality line. Is it the lockdown or is it the virus? So we'll see that here.
Fear of the Omicron variant, where we're seeing mild cases spread and trickle in, has prompted Andrew Cuomo's genius successor, Governor Kathy Hochul, to announce that New York will enact emergency law and suspend elective surgeries and routine medical checkups in emergency care centers. That already happened last year, and it was a disaster. Millions were forced to skip routine cancer screenings,
Yes,
and even childhood vaccinations. We get called anti-vaxxers, but we're saying, kids should be able to go in and get their routine vaccinations. And these governors
That's an elective surgery.
are going back to this procedure, these restrictions that prevented that. And what did that lead to? Almost 10 million screenings being missed in the US in May 2021. Over 50% of Germans around the same time through 2020 and early 2021 missed routine cancer checkups. And now we're seeing a surge in cancer cases and cancer deaths. We're also seeing hospitals filled up, ICUs filled up with people who do not have COVID because they had to wait so long to get their routine checkups.
So I don't know where Max lives, but in New York, we had refrigerator trucks full of dead bodies at the beginning of the literally refrigerator trucks full of dead bodies, because a lot of those people could not get the care they wanted at first when we didn't have restrictions on care. Also because we were the world's
because the hospitals were filled with COVID patients.
Exactly. I mean, when you talk about the cart before the horse, this is another one of those things.
We slapped the lockdown restrictions on in late March. And you see, if you look at New York COVID cases, they go up. We put the lockdown restrictions in late March. They continue to go up. And then they plummet.
Because there's going to be a little increase as it kicks in. And then by the summer in New York City, we had, I think, one half of 1% infection rate of COVID. Yep. That was probably better than this past summer almost. I mean, it was pretty solid. And that was before we had the vaccine. So clearly the New York City lockdowns were very effective in terms of stopping the spread of COVID.
I'm also a little confused as to what New York's lockdowns or American restrictions, let's call them have to do with Germany?
In the US, which I know best, there was never a period where medical offices were fully closed under government orders. There were, for brief periods very early in the pandemic, when a lot of people thought that it was kind of just going to go away in a few weeks. There were some medical facilities that voluntarily shut down for a while. And you would typically, a cancer screening is something you get at a primary care physician's office. You're not going to a hospital to get that. So that would be like a primary care practice shutting down for a few weeks in March or April. And for a small number of people who wanted to get care during that time, it could have created problems. but they opened back up. If you can read these governor emergency orders or county executive emergency orders, none of them closed healthcare facilities. Largely, the reason people weren't going to get screenings was because they were afraid of getting COVID.
Yep, myself included, not for cancer. I'm saying I delayed some medical stuff because I didn't want to go into a hospital in May of 2020. And it's just like what you're saying, Justin, about people not going back to work. The main reason is just because they personally did not feel comfortable doing that. They didn't feel physically safe.
It's also worth pointing out that Hochul's new order, it's Hochul, not Hochul, Hochul's new order to allow the state to cancel elective surgeries is a preemptive move, although hospitals upstate right now are not doing so hot, to preserve hospital capacity because we are staying open. Like,
yes, and also because what we saw happen, and because they want to prevent what happened last March.
Right.
They saw what happened with the trucks full of bodies, and they want to prevent that. But also, I fail to see the connection between a stoppage of elective surgeries and child vaccinations.
Right.
That's another very strange.
Wait, let me just finish this though, because it's important that Hochul has been pushing since last month to get everyone back into offices. That hasn't changed. So, when lockdown in New York, what are you talking about?
Like,
come to New York, or at least do any reporting on New York before you talk about it. Let's move on to because I do want to get through these.
Focus on how these lockdowns impacted the global South, where people live just above the poverty line in many or most global South countries. And when you miss a day or two of work, which can be in the informal economy, in the marketplace or fishing, you starve. And that's what the lockdowns did to people from Senegal to Peru, is starve millions. And in South Africa in April 2020, almost 50% of the population went without food for a substantial period.
So remember, these are we talked about this earlier. He is attributing it all to lockdowns, but remember that long list of factors. So this to me rings untrue.
Yeah, I mean he's just not he's not mentioning countries that I think he often does talk about in his reporting, like China and Cuba, that did take a much more interventionist approach to the pandemic. And did so in a way that did protect their working class populations to a large degree, to the extent that they could in Cuba, and of course China, being wealthier, was able to do that better. But it's as if.
What about Brazil? Can we talk about Brazil? I mean, they had hardly any restrictions, right?
Yeah.
How are they doing? How are their deaths doing?
One of the highest death rates in the world, and yeah, just like extreme levels of infection early on in places like Manaus, and just continuing on. So there's no acknowledgement of the actual toll of disease and death, and all of the economic issues are attributed to public health measures rather than things like recession, people being afraid to go out because they don't want to get infected, and also the general kinds of imperial and neo-imperial relations that exist between the global North and the global South. This really was a time when the global North countries should have been substantially upping their aid and suspending debt payments precisely so these countries could support their populations while they were trying to keep the virus at bay.
All right, let's hit this next one.
The lockdowns in the US, which were actually advised, ironically, by the Trump administration through his COVID task force director, Deborah Birx, was inspired by the one in the UK. And that lockdown in the UK, which initially was not recommended by Boris Johnson, was triggered by a model produced by the Imperial College in London, which is funded by Bill Gates to the tune of $25 million. And an academic, Neil Ferguson, who has no experience in epidemiology and is not a data scientist, who overestimated the projected COVID death toll in 2020 by a factor of 6, and was basically saying that up to 5% or maybe greater of the population would die unless the UK went into hard lockdown. By March 15th, March 16th, the Trump White House had that model in their hands, and they shifted policy to recommend hard lockdowns. And what it led to, this phony, bogus model, the WMD scare of the pandemic, was death, deprivation, isolation, and suicidal ideation for hundreds of millions of people around the globe, and we're still not recovering.
All right.
Wait. Hundreds of millions of people committing suicide, dude. It's a bit exaggerated, folks.
For suicide, which seems a lot harder to pin down. But it's worth pointing out that on March 24th, 2020, Donald Trump was encouraging the country to reopen. He said, don't forget, this has never been done. We've had flus before, we've had viruses before, so this is something new, and this is why I say we have to. I gave it 2 weeks, and I guess by Monday or Tuesday is about 2 weeks, and we'll assess at that time, and we'll give it some more time if we need a little more time, but we have to open this country up. So he
was talking about by Easter, it's going to be gone.
Yeah, he was saying
Easter.
We're going to open up by Easter. This is not an administration that was pro lockdown. He was trying to push the country open after 2 weeks.
So what was Blumenthal's? So when he talked about that British academic, he said that the guy overestimated global deaths by a factor of 5 or 6. It sounds like he was estimating the deaths without any action, without any public health intervention, right?
Yep.
So
Exactly.
when they did do public health intervention and it was less than he predicted, that doesn't prove anything.
Exactly. So there's a number of distortions there. First of all, I think he said Niall Ferguson, who's a historian. It's Neil Ferguson, who he claimed wasn't an epidemiologist, but Neil Ferguson is most certainly an epidemiologist. Okay. He is one of the top infectious disease modelers in the UK and the world. So it's
research, man.
It's very hard to do infectious disease modeling, especially with a new disease, because a lot of assumptions have to go into it. And he did predict many deaths, yes, under the case of business as usual. So everyone having just as many social contacts as they normally have, no preventive measures, would lead to millions of deaths. And potentially there's uncertainty built into the model, but there's this thing called the precautionary principle in public health and in environments. And often it's been a part of left-wing movements like environmental movements, which is to say, if there's something new and it's potentially harmful, yet we have uncertainty about it, we're going to take measures to act as if it may be pretty harmful and we want to prevent it. We're going to be precautionary. So even if it was never going to cause 5 million deaths, which still, time will tell, it was certainly worth taking these actions to prevent it. And the actions in the UK were taken too little, too late. There was initially a herd immunity through infection strategy attempted before they changed.
Thanks to our friends at the Great Barrington Declaration.
Yeah, well, there's also, and we don't have to go into this, but there is another group largely out of Sweden that has both influenced Swedish domestic policy and influence policy in the UK and in the global South, trying to push against any kind of public health interventions. So they influence the UK also.
So it's also worth pointing out that The Economist, according to their projections, where they're looking at COVID deaths and trying to correct for underreporting, they estimate that the pandemic's true death toll is 17.8 million people. And they think that there is a 95% chance that the actual value lies between 11.1 million and as high as 20.7 million. I mean, that is a staggering number. That's hard to even fathom.
But that's with many, many countries doing all kinds of public health interventions.
Mm-hmm.
So if you're just going to ballpark, what would it be if there was no intervention whatsoever and everyone had their goggles on and could care less about COVID? I mean, it very well could be over 100 million.
Yeah, in China alone, China's the most populous country in the world. They've had only about 5,000 COVID deaths. If they pursued the same strategy as the UK or US or Brazil, we would have seen many millions of deaths there.
Yeah, I mean,
Let-
we've had what, 800,000. So we're
Officially,
only
it
one.
was
Officially,
We're
yeah.
only about one
And-
fifth of the
And,
size of
and
China.
Justin, I do believe you said that the CDC estimates an undercount by 30%.
That's right. So it's possible, and there's uncertainty in these models, but it's possible that we've already passed 1 million deaths in the U.S. And yeah, so specific causes of death are often underreported in the U.S. I did my doctoral dissertation about that, about police killings being underreported in U.S. mortality data. But it's the same thing. COVID deaths are underreported in U.S. mortality data, just because it's hard to know sometimes exactly what someone died of. They may not have tests available, and there's misclassification going on that ultimately leads to underreporting.
All right, let's take a look at this next clip because I think this one is quite entertaining. I hope you guys agree.
Austria, Germany, countries like Slovenia are going back into lockdown. And they're not even really justifying these lockdowns on any public health basis. What they're saying is it's punitive. The unvaccinated must be locked down to punish them for their choice, for their refusal to comply. And in Germany, we saw a constitutional law lawyer call for the unvaccinated who refuse to abide by the lockdowns and who are even willing to go to jail because prison sentences will be imposed on those who can't pay monthly fines, that they should be taken before the vaccinator by the police. So this is forced vaccination is on the table in Germany. And this idea of the vaccinator, it conjures up terrifying images like, I am the vaccinator. Some guy in like a leather suit with a giant needle just
Get
has
this guy
to
in a
be
movie
dragged
right
before him
now.
by the cops to force needles into their veins. This was like a bizarre conspiracy theory that anyone would have been laughed at for spouting back in 2020, and now it's on the table. So the lockdown is part of a punitive control mechanism after already being completely discredited.
What the actual fuck? Is any of that true? Is any of that true, by the way? For those two countries, do we know if any of that, given the amount of lies he's already said, like per
there
clip
have been proposals to restrict access to indoor spaces for unvaccinated people in Austria, and I think Germany is considering it,
Yep.
and the EU is considering it.
a lot of businesses do that right now in the United States, by the way.
Yeah. So if you're in New York City, you have to show
be
vaccination to go to a restaurant.
Go to a restaurant, yeah.
But nobody vaccinates into veins. Okay, let's just can we just like, take a step
Vaccines
back?
go into muscles, not.
I think Max deserves his own GIF, honestly. GIF, sorry. Just like this one, we're just doing. Oh man.
Yeah, I think there's debates to be had over like should these measures apply only to vaccinated people or to all people? Under what conditions should vaccination be mandatory? Certainly in workplaces where you're likely to expose coworkers, customers, patients to a virus if you're sick, it certainly makes sense. Should you do it more broadly? I think maybe not. Like that's we can talk about that. But this guy in the leather suit, like I don't know, I kind of don't know what he's talking about.
Yeah. So here, let's go to this next clip. This one is a little less. No leather, no guys in leather suits, unfortunately.
If you just browse our article or you read the entire thing, you will be horrified not only by how much people suffered under these dubious policies,
not by that,
but how much this was covered up by mainstream and corporate media.
Not that
and we were simply told, well, the pandemic did this. This is the fault of the pandemic, as if the pandemic is a policy or the pandemic is a political choice. No, it was the political choice based on phony data of bogus neoliberal governments influenced by supranational bureaucrats to do this to their population.
I do want to address something that he's saying, and that is he's calling this neoliberal governance, that lockdowns, these measures, which to him include paying people to stay home to just police enforced lockdowns, whatever it is, he calls that neoliberal governance. Neoliberalism is actually that is the antithesis of neoliberalism, an active intervention by government to you know, to take control and to, you know, to sort shit out. That is not neoliberalism. Like the neoliberal pandemic response is private sector in the States, you guys handle this. Federal government, we're going to stay out. We're going to
let the
you do what we
market
do.
work it out.
That's what we're doing
now. Let the
now.
free market work it out, which, by the way, the funders of the Great Barrington Declaration are all about that.
Yeah, that is neoliberalism. If you can't even recognize the thing that you're railing against, like, I'm sorry. I feel like that undermines the entire basis of whatever. I mean, everything.
Well, it does because both those characters and several others who we don't need to bring into the conversation today, they are actually on the side of big business and the right-wing economists, and they may not realize it, but that's actually closer to their viewpoint than the progressives in the left. So it's kind of ironic that they're throwing around these terms they don't actually understand. And then thinking that they're actually taking the populist position when they're actually taking the big business position.
Yeah, and again, no mention of Cuba, China, Vietnam,
You keep saying
native nations in the U.S. like Cherokee Nation, Blackfoot Nation, all that took and social democratic countries like Denmark. All of these left or indigenous governments took much more interventionist stances, and then these right-wing neoliberal governments like the U.S. and Brazil and India, after a brief attempt at lockdown, took much less public health interventionist approaches. So just absolutely no like sense of what's happening in the world.
I want to hit one more clip because I think we've beaten everything else to death. Let's get to this clip because this one, I think, well, you'll see.
I can't wait, Walker.
Concerned with the construction of a biomedical security state where a healthy population has been defined as a public health risk because they have not obeyed state mandates to take a big pharma product that does not prevent viral transmission.
Well, it reduces. I have to say, it reduces it. It reduces
transmission according to the government and state regulatory bodies.
Yes, that is correct.
Are telling YouTube what to do.
That is correct.
Yes.
Wow. Yo, he's crazier than Jimmy Dore on vaccines. Oh my God, that's an impressive feat, folks. I mean, give him a round of applause.
This is a good one to wrap up on, I think, right? Like let's just talk about this, right? This is straight up anti-vax nonsense, right?
Absolutely bonkers, right?
Yeah. And it's also almost goes without saying, but it's a lie. It's not just government regulatory agencies saying it reduces transmission. It's independent scientists working for universities, publishing in private peer-reviewed journals. It's not what he's saying.
So Justin, give us the truth about vaccines, Justin. Give us the truth.
The best way I can put it is that getting vaccinated is the best way you as an individual can protect your health and the health of others. I can also say it's not enough as a society to only rely on vaccines. We need to combine vaccines with other health measures. And we also need to vaccinate more people because there's too many unvaccinated people. And it's largely unvaccinated people who are ending up in the hospitals and who are ending up dead.
So part of that would be releasing the vaccine IP to the world, which you don't hear anything about if you only read Max Blumenthal or listen, I mean, that's
because they don't believe in pharmaceutical intervention, apparently.
Or non-pharmaceutical intervention. It kind of sounds like all
they
believe in is just letting this virus rip through the population to achieve herd immunity by infection, which sounds an awful lot like what Jay Bhattacharya
Donald fucking Trump
and Donald Trump and
it's really, so he's mentioned healthy populations a couple times and how healthy populations shouldn't be quarantined, shouldn't be subject to vaccination. There's an element of social Darwinism here, both in him and the entire anti-vax and anti-public health current, which is that basically like, if you're healthy, you are worthy, you can withstand this virus, which if you're not disabled and if you're young, has a low fatality rate, We won't think about long COVID because we can kind of hand wave it away because there's uncertainty. And if you're disabled and if you're old and you get infected, well, I don't know. They're questioning the value of the lives of the people who are most likely to die, who are also most likely to be people of color and working class.
Sounds a little like eugenics.
Yeah, but also if you listen to Jimmy Dore, if you follow his work, I mean, he's a big proponent of ivermectin, which is not a recognized cure or treatment for COVID infection. But you could just go back a couple months to Jimmy Dore's proponent of ivermectin and just go to your local feed store, and that way once you purchase the horse design medication, you can stave off any of the major effects. I mean, my friend Joe Rogan took ivermectin, and he also got some anticlonal antibodies or whatever.
I really don't like it when you call it horse paste. It is technically a drug you can use in humans for parasites, but the main groups promoting ivermectin were selling ivermectin and profiting.
Yeah, well, they were profiting off of the human version. Yeah. And the problem is, but they contributed to this craze of all these right wingers trying to find it. And when they couldn't get, by the way, these doctors were very rarely actually getting the medication to the customers. They're ripping them off with $90 sessions and then not helping them at all. There was a lot of complaints about that. So it was many levels of fraud. There's the America's Frontline Doctors group that I've reported on. But it was causing all these people to go to the feed stores in order to get the horse and cow version because they couldn't get access to the prescription-based human version.
Wait. Okay. So before we go, your final thoughts here. Justin, before you begin, I want you to just explain to people why you are qualified and they should listen to you over.
Yeah, so I've been in public health for over a decade now. I have a doctorate in social epidemiology. I study mortality data systems. I also have been a leftist since I was a teenager, and have followed various right-wing arguments and how they construct their arguments. And these are just textbook 19th century right-wing arguments around, the cure is more harmful than the disease. That's called the perversity thesis. They were saying welfare is just going to create more poverty. They were saying democracy is going to create more tyranny. These are just rehashing of age-old right-wing arguments. And I've been following them very closely for the last 18 months or so.
So how do you feel about paying people to stay home?
I think
as a pandemic control measure.
Yeah, I think it's generally a great idea. If people, I think we need to pay people to stay home when disease rates are high to protect themselves. That's not alone, it's not enough. We need to do things like mandate ventilation and testing and paid quarantine and isolation for essential workers who have to go in anyway. We have
hazard
to do
pay.
a lot of things.
Justin, tell everyone where they can find you.
Actually,
or don't. Or
you can
don't.
find me on Twitter, jfeldman_epi, EPI for epidemiology. And if someone sends a troll army my way, I may block it temporarily, but don't let that deter you.
And Alex, tell everyone where they can find your work.
Yeah, I currently work for the Center for Media and Democracy. That's exposed by cmd.org. I post all my stories on Twitter at Alex KOTCH, Alex Koch. Come on, trolls. I've been attacked by Nazis before. I don't fear you. I really don't care what your opinion is. But I will block if necessary.
All right, fair enough. And as always, I'm Walker Bragman. Thank you for joining us for this very special episode of Gilded Age.